The health issue which affected my grandfather was heart attack or acute myocardial infarction. He was 50 years old. On the 2nd, 11th, 1986, at 4 p.m., he was resting on his bed after lunch when he developed a severe chest pain, which was like a crushing sensation in his chest. This is associated with sweating, shortness of breath, dizziness, nausea, and vomiting, and feeling faint. His breathing difficulty worsened as he became more drowsy and appeared pale. He later lost his consciousness. My grandmother, with the help of neighbors, helped in transferring him to a nearby hospital. But he passed away in the car and was declared dead on arrival at the hospital. Summary. A heart attack occurs when one of the arteries that supplies blood to the heart is blocked. The underlying cause is coronary heart disease, or CHD. Risk factors for CHD include smoking, high cholesterol, obesity, diabetes, high blood pressure, and increasing age. A heart attack is a medical emergency. You must call 000 for an ambulance if you have warning signs of heart attack. Signs and symptoms. The warning signs of a heart attack include pain, pressure, heaviness or tightness in one or more of your chest, shoulder, neck, arm, jaw, or back. You may also feel nauseous, feel dizzy or lightheaded, have a cold sweat, feel short of breath. You may have just one of these symptoms, or you may have a combination of them. Symptoms can come on suddenly or develop over minutes and get progressively worse. Symptoms usually last for at least 10 minutes. Diagnosis. The diagnoses are electrocardiogram or ECG, which is a reading of the heart's electrical impulses. A blood test, which is to measure levels of heart enzymes. Coronary angiogram, which is a special X-ray of your coronary arteries. Treatment. Medicines to dissolve a blood clot. Angioplasty and stent implantation, a procedure to open up a blocked coronary artery using a balloon at the point of narrowing. Bypass surgery, an operation in which blood flow is redirected around a narrowed area in one or more of coronary arteries. Long-term use of medicines to lower the risk of further heart problems. Example, aspirin, which is a statin or a type of cholesterol-lowering medicine, etc. Implantable cardiac defibrillator, which is a small device that is sometimes implanted near the heart to manage abnormal heart rhythms and may occur after a heart attack. Healthcare facilities. The healthcare facilities available to an individual experiencing symptoms of a heart attack are in an emergency call 000, which alerts the ambulance service and helps in transferring the patient to the nearest emergency department of a hospital. The Heart Foundation's Health Information Service can provide phone information. A doctor or health professional can also provide advice. In the hospital, the patient is given medications to control his chest pain, oxygen to help his shortness of breath, and medicines to help dissolve the blood clot. Some hospitals have cardiac catheterization labs where coronary angioplasty and stent insertion are performed. Emergency departments where the patient is initially assessed and managed, and in coronary care units where the patient is subsequently monitored after angioplasty. And the last one is cardiac rehabilitation programs. Thank you for listening to my digital story.